Welcome to this presentation on QuickPaths, your agency solution for clinical pathways. We are happy that you're interested in finding a program that will give your agency the market edge in this healthcare reform era of transitional care and accountable care organizations. Over the next few minutes, I will be sharing with you the reasons why the QuickPaths are your solution to quality outcomes and a great report card on Home Health Compare. You see, regardless of the changes in healthcare, quality outcomes remain the #1 priority, and QuickPaths were designed from the #1 clinical pathway in home care, the VNA First Home Care Steps protocols. Healthcare today is drastically different from the healthcare of yesterday. Today's healthcare of transitional care and accountable care organizations demand data and quality outcomes with closely monitored cost containment. Clinical pathways are part of the answer. They standardize care and provide a more predictable outcome. The use of clinical pathways encourages the patient to participate and take control, and it enables healthcare providers to integrate the total quality management process into the clinical arena. Clinical pathways provide a structured approach to delivery of home care and delineate the patient-caregiver interaction for each visit. Patient instruction is in planned segments and is sequenced over the certification period. A clinical pathway model demonstrates to third-party payers the quality and consistency of care delivered. It clearly states what services are provided and in what time frequency. The structured plan clearly defines the clinical outcome. By using a prospective payment plan or an agreed-upon amount based on the patient's diagnosis, acuity, and level of functioning that is contracted before the care is delivered, the agency becomes more efficient as it streamlines care and better manages utilization of resources and personnel, and the payer maintains quality and has a predictable outlay of funds in this value-based purchasing healthcare reform era. So why do you need clinical pathways? Well, quality outcomes are an obvious goal of healthcare delivery systems, and the key to producing high-quality outcomes comes through the use of evidence-based clinical practice. Evidence-based clinical practice means that there is consistency and reliability among clinicians' practice patterns. It means that you are following the standard of care. It is no surprise, then, that CMS recommends clinical pathways because they integrate the standard of care. These tools will be a necessity for viability in the era of chronic disease management and value-based initiatives like accountable care organizations. They promote patient self-management. They will help you compete in this new healthcare market and be #1 in your area. Can you say for sure that certain standards are being met for all your patients, regardless of payer or setting? Well, you can if you use QuickPaths. A standard of care is a package of care that all patients should receive, regardless of payer. Standards of practice are the interventions we do to ensure consistent quality outcomes. No agency wants to be placed in a position where their standard of care is at stake. But how can you ensure that each and every nurse is maintaining it? By using a clinical pathway. In today's market of transitional care and ACOs, you have to demonstrate that your clinicians are following the standard of care and ensuring that regardless of the payer, that the best possible care is being given to each and every patient. With QuickPaths, that standard of care is already built in. Small differences in care can compound like a bank account and make tremendous differences in your agency's outcomes. Pathways level the playing field. They are a standard package of care. Many of you may still be using narrative notes, and in that case, can you honestly say that all of your clinicians are delivering the standard of care to your patients? Well, the only way to guarantee that is to use clinical pathways that have these standards from all of the accrediting bodies incorporated into them. And standards of practice must remain the same regardless of the type of visit. Another key to quality outcomes is promoting patient self-management. Quick paths incorporate core interventions in each visit to address standards of practice. This helps achieve quality outcomes that are sustainable. With quick paths, you are ensuring that you are meeting standards of care and other evidence-based practices, including meeting the best outcomes that you can. All patients are assessed every visit for core outcomes on stability, outside resource use, as well as key elements like medications, activity, nutrition, hydration, and psychosocial issues. With clinical pathways, we must always meet the standard of care. This slide demonstrates, for instance, in a diabetic patient, that we must meet the gold standard for diabetes care. And you can see here the standard of care means that clinicians need to address diet, disease exacerbation, complications such as retinopathy, glucose control, sick days, self-care, prevention. Can you honestly say that your clinicians are doing all of these things? Well, you can if you use quick paths. Today's healthcare environment needs quick solutions that will sustain your agency through tomorrow's changes. Quick paths are one solution. Quick paths are a new, unique documentation tool, a clinical pathway that gets right to the point, a one-page tool that your clinicians will love. It is easy to read and easy to follow. It has standardized language with evidence-based protocols. The interventions are side by side with matching outcomes that make decision-making easy. Written by clinicians, for clinicians. They are your solution for healthcare reform. We all know that the model for healthcare has changed. With healthcare reform, we're now using the chronic care model. The chronic care model is a proactive, systematic approach to the delivery of healthcare through a holistic manner. It was developed by Dr. Ed Wagner to improve chronic illness care. It transforms the healthcare delivery system. It turns reactive healthcare into a proactive or preventive system. We know that within this system, clinical pathways, clinical algorithms are a must-have in transitional care and accountable care. Quick paths will help your agency improve outcomes, reduce ED visits, improve efficiency, reduce hospitalization, and improve continuity. With quick paths, your agency will have improved outcomes and your report card will reflect an improvement in your quality indicators. So without a clinical pathway, agencies are gambling with their outcomes because consistency in practice leads to predictability in results. This leads to high-quality outcomes. With quick paths, you are ensuring that you are meeting standards of care and other evidence-based practices. I mentioned the importance of following evidence-based guidelines. If your nurses are charting narratively, how can you be sure they are following evidence-based guidelines? Well, you can't. In the quick paths, each disease-specific pathway is built on up-to-date evidence-based guidelines. For example, for the diabetes pathway, here are just a few of the clinical guidelines that were resourced and incorporated into the pathway. Clinical practice guidelines were taken from the American Diabetes Association, the American Dietetic Association, the American Association of Clinical Endocrinologists. The accreditation standards were also incorporated, and as these standards change, they are updated in the pathway. So, what are clinical pathways specifically? Well, specifically, they are a set of interventions and outcomes that must occur for a desired outcome. They are the documentation of standardized interdisciplinary care that allow for individualization of the patient's plan of care, show variations from standardized processes, and they operationalize best practices. They are organized and predictable, which is the key to reducing risk. They represent sequencing and timing of interventions by clinician to help minimize delays and improve resource utilization. They take the guesswork out of charting So clinicians are cued on each and every visit to know what to teach and what to do. They are also used to monitor and control a patient's progress. With a clinical pathway, a clinician can easily see a patient's progress and determine if other resources need to be utilized, such as pulling in a social worker. They are measured according to standard process and clinical outcomes, such as an episode of care. But it isn't just the type of interventions that are important, it is also the timing of the interventions. Interventions must build on one another, and the patient must grasp lower-level information before understanding higher-level information. Let's look at the example of diabetes. A patient must be taught very basic safety information like what is diabetes before he can understand more abstract or more difficult information like injection site rotation. Clinical pathways ensure clinician consistency and standardization so that every patient can achieve the highest outcomes possible. This also allows less experienced nurses to provide the same level of care as an expert nurse. Not all of our nurses have the same level of experience and knowledge in each disease state, so clinical pathways help level that playing field. Let's look at the components of the quick paths. There are 4 main components: the category of care, visit-specific interventions, short-term and long-term outcomes, and the timeline. We know that clinical pathways can also help cue the nurse on every visit, and so these interventions are going to lead to improved outcomes on home health compare, such as a decrease in hospitalization and emergency room visits, improvement in compliance with medications, dyspnea, ambulation, and bathing. The documentation components of the quick paths include a pathway overview or profile, visit-specific notes that can be used on home visits or telephone visits, co-steps for comorbid conditions. There's an add-a page for additional documentation, a clinician field guide to help give detail about how to use these very easy-to-use quick paths. They can be used in home visits or telephone visits, and there is a variance tracking tool that is optional depending on how much detail or data you want to obtain. The first component is the pathway profile. This is like a hospital Cardex. Here the clinician is able to individualize the plan of care and decide on the specific problems that fell out from OASIS. This tool also allows everyone to be on the same page. So if a PRN nurse is seeing the patient, she can look at the profile or what she should focus on. So little time is lost in addressing specific patient needs. This form is updated just like a Cardex, so the clinician always knows what and when labs or treatments are due. Let's take a look at the sample visit note. At the top is the head-to-toe assessment. On the right side, we see adverse event cues. So the clinician is cued on every visit to look at ADLs and pain and UTI risk. The variance codes are listed on the form. There are 10 variance codes. The visit-specific interventions are listed on the left side. Right next to them is the associated outcomes. The clinician marks the outcomes as being met with a check mark or not met with the variance code. The interventions on every visit address stability, resource use, and core elements like diet, activity, medications, and psychosocial issues. Each visit note is unique in that each visit builds on the previous visit. All clinicians are giving the same care on the same visit. This provides consistency and helps our clinicians, as well as your less experienced clinicians, to deliver excellent care. The first 2 outcomes are always addressing stability, so on each visit the clinician will address that the patient demonstrates no new or worsening signs and symptoms and that there was no unplanned resource use, like an emergency room visit or hospitalization. The remainder of the outcomes are all very specific to the interventions that were addressed on this visit. Because each visit builds on the previous one, it is important that the patient achieve the outcomes. Because lower level outcomes are the building blocks for higher level outcomes. So if a patient has not met 3 or more outcomes on a visit, it is recommended that the visit be repeated. That means the same material will be presented on the next visit. Otherwise, if you advance the patient, you are setting him up for failure. With quick paths, this ensures that your clinicians are evaluating outcomes on each and every visit. Your payers will all want to see this. We also have the additional variance tracking tool, and this is if you really want to collect that very important data. And you can add this at any time once your clinicians get up and running with the clinical pathway. You can see from this slide on this tracking tool that outcome number 1 was not met 3 times because of primary signs and symptoms of disease exacerbation. You can see that the patient used the emergency room related to signs and symptoms of disease exacerbation on the second outcome. And for the compliance or behavior outcomes, you can see a mixture of reasons why the outcome was not met related to psychosocial, cognitive, caregiver, and primary diagnosis signs and symptoms. This gives you a great picture of what has happened so far in the episode and triggers the clinician to evaluate the care a little closer and possibly to case conference. We know that our patients come with many diagnoses, and in some cases you have to address those comorbid conditions if you see an educational issue or if the patient is unstable with a comorbid condition. Co-steps were created to address those issues. This is an example of a co-step for nutrition risk. It is a simple flow sheet with problems, goals, interventions, and outcomes. The clinician can check each box as the intervention and outcome is met. A variance code could also be used to explain why an outcome was not met. This is a simple, easy-to-use tool, and it is a care plan also. The quick paths are unique in that they are a disease management model. The underlying disease management model and framework for this pathway program is based on levels of patient outcome achievement. This is important for value-based purchasing. The interventions and outcomes change focus and level of disease management as the patient progresses through the pathway and through the episode. In other words, if the outcomes are achieved within certain planned visit protocols, then different levels of disease management are achieved. For example, visits 1 through 3 may be focused on safety, visits 4 through 7 may be focused on disease control, and visits 8 through 10 may be focused on health promotion or higher levels of self-management. Safety interventions and outcomes are aimed at helping the patient achieve a stable status, prevent an occurrence, or obtain assistance. For example, in visits 1 through 3, some outcomes might be that the patient verbalizes how and when to call for help, verbalizes 3 signs and symptoms of disease exacerbation, and demonstrates no new or worsening signs and symptoms. Disease control interventions and outcomes are aimed at helping the patient maintain a stable status and prevent acute exacerbation of their primary condition. Some outcomes might be that the patient demonstrates tolerance of their med schedule and activity and diet. Health promotion interventions and outcomes are aimed at helping the patient achieve a high level of self-care so they are able to maintain or improve their general health status for their primary and secondary conditions. These interventions also help patients comply with behaviors to prevent reoccurrence or new illness or injury. For visits 8 through 10, some outcomes might be demonstrates the ability to access community services, demonstrates appropriate mechanisms for changes in lifestyle. With the use of pathways, the benefits for your agency are many. Pathways will improve team communication, improve documentation, reduce length of stay and variation in patient care, improve quality of care and outcomes. They will help you manage your risk in this risk-driven new healthcare market, and they promote the collection of data, which is what your payers want to see. Pathways will increase your success. You will see improved outcomes, and your patients will see improved health and quality of life. Quick paths are the key to success in transitional care and ACOs. They are the key that will keep your agency at the top. With the use of quick paths, you will see changes in your home health compare results. Your hospitalization rates will be reduced, and your other indicators like medication compliance will improve. That is because these core outcomes are addressed on each and every visit. The clinician is cued to investigate and perform best practices. So why do you need quick paths? Well, quality outcomes are an obvious goal of healthcare delivery systems, and the key to producing quality outcomes comes through the use of evidence-based clinical practice following the standard of care. You need to be ready for chronic disease management, and you need to be ready for transitional care and accountable care. You need clinical pathways to be number one in your market. I just want to talk about the differences between the two pathway systems that we offer. We also have a 2-page pathway called the VNA First Clinical Protocols. These are a little bit more detailed interventions, and we also have you document or variance the interventions as well as the outcomes. We also drill down into variance subcodes. We do include the tracking tool, and we do offer some on-site training. The quick paths are 1-page, much broader interventions. You do not document against the interventions. You do have cues on all the visit notes for ADLs. We just keep the variance codes very broad. There are no subcodes, and variance coding on the variance tool is optional. These are so easy to use. You can teach your clinicians overnight. No on-site training is needed, nor is it provided. We do give you an education manual that is quick and easy to use and implement. Quick paths are very easy to implement, very easy to use. So in summary, clinical pathways are advanced care management, which is a necessity in healthcare reform. So call us today for more information at 630-236-4603 and order your starter set of quick paths today so that you can compete in the new world of healthcare reform.